I'm Dr. James Whitaker, and it's one of the most frustrating and confusing experiences a man can face. Everything starts off perfectly fine. Arousal is there. The erection is strong and reliable. But somewhere in the middle of intimate moments, it simply fades away. The silent struggle affecting millions of men. If this has happened to you, I want you to understand that you're absolutely not alone. Many men, even those who have no trouble achieving an erection initially, experience sudden loss of firmness during sexual activity. While it can feel embarrassing, alarming, or even emasculating, the truth is that it's far more common than you might think, and it often has clear, manageable causes. After treating thousands of men with sexual health issues over the past 2 decades, I can tell you that this problem affects men of all ages, backgrounds, and health statuses. The good news is that understanding the underlying causes is the first crucial step toward finding effective solutions. Today, we're going to explore 3 of the most common reasons why erections fade during sex. Not just the surface-level symptoms, but what's actually happening inside your body and mind that can lead to sudden loss of firmness right in the middle of intimate activity. By the end of this comprehensive guide, you'll understand your own physiology much better, and more importantly, you'll know exactly what steps to take to improve your sexual performance and confidence moving forward. The complex mechanics of erection maintenance. To understand why an erection might be lost unexpectedly, we first need to understand the remarkable complexity of how erections happen and are maintained. An erection isn't just about sexual arousal. It's the result of an intricate interaction between your brain, nervous system, hormones, and cardiovascular system. The process begins with sexual stimulation, which sends electrical signals from your brain down your spinal cord to specialized pelvic nerves. These neural signals trigger the release of a crucial chemical called nitric oxide in the penile tissues. The nitric oxide cascade. Nitric oxide functions as a powerful vasodilator, meaning it relaxes the smooth muscles lining the arteries, especially the cavernosal arteries inside your penis. This muscular relaxation allows dramatically increased blood flow into the corpora cavernosa, the 2 sponge-like chambers that run the length of your penis. As these chambers rapidly fill with blood, pressure builds significantly, causing the tunica albuginea, the firm, fibrous outer layer surrounding the corpora cavernosa, to expand outward. This expansion creates crucial compression of the veins that would normally allow blood to drain out of the penis. This venous compression effectively traps the blood inside the erectile chambers, maintaining firmness and rigidity. It's an incredibly delicate and precisely coordinated process, and if any component of this complex chain becomes interrupted, whether by physical, psychological, or chemical factors, the result can be sudden, devastating loss of erection. Subscribe to American Urologist right now. If you're finding this detailed medical information valuable, I share advanced men's health secrets every week that could transform your sexual confidence and performance. Hit that subscribe button and notification bell so you never miss crucial information that could change your intimate life. Because number 1, cardiovascular compromise, the silent performance killer. One of the most overlooked reasons for losing erections mid-activity involves cardiovascular health problems. This connection is critical to understand because erections depend entirely on optimal blood flow, and the blood vessels involved are surprisingly small and extremely sensitive to circulatory problems. Consider this shocking anatomical fact. The cavernosal artery supplying your penis measures only about 0.4 millimeters in diameter. This is significantly smaller than the coronary arteries supplying your heart, which range from 0.8 to 1.5 millimeters wide. Because penile arteries are so narrow, any condition that impairs circulation, including high blood pressure, elevated cholesterol levels, cigarette smoking, diabetes, obesity, or even normal aging processes, can dramatically affect your ability to maintain erections. In fact, erectile dysfunction often serves as the first warning sign of broader cardiovascular problems that haven't yet affected other organ systems. When arteries become narrowed through atherosclerosis or lose flexibility due to endothelial dysfunction, the amount of blood that can flow into penile tissues decreases substantially. Your erection might begin strong because initial arousal triggers maximum vasodilation, but it cannot be sustained because insufficient blood volume reaches the corpora cavernosa to maintain necessary pressure. The hydraulic system simply lacks adequate flow to keep the chambers inflated. This isn't just about heart health. It involves your entire circulatory system. When the tiny vessels supplying your penis become compromised, it signals that other parts of your cardiovascular system may also be under significant strain, even if you don't yet feel symptoms elsewhere. Cause number 2, tunica albuginea dysfunction, the structural failure. Another critical but often overlooked reason for losing erections during sex involves problems with the tunica albuginea, the tough, fibrous layer that surrounds the corpora cavernosa. Understanding this structure's function is essential for grasping why some men lose firmness despite adequate blood flow. The tunica albuginea's job is absolutely critical for erection maintenance. As your penis fills with blood during arousal, this fibrous layer must expand outward while simultaneously compressing the veins that would otherwise allow blood to drain back into your general circulation. This venous compression mechanism is what traps blood inside the erectile chambers, creating and maintaining the pressure necessary for firmness. However, when the tunica albuginea becomes less elastic or structurally compromised, often due to chronic conditions like poorly controlled diabetes, it fails to apply sufficient compression pressure. When venous compression fails, blood begins leaking back out of the erectile chambers prematurely, even while sexual arousal continues. This condition, called venous leak or veno-occlusive dysfunction, represents one of the most frustrating causes of erection loss because everything appears to work initially until it suddenly doesn't. The tunica albuginea requires both flexibility and structural integrity to maintain necessary compression. When this tissue becomes rigid, scarred, or thinned due to metabolic damage, its ability to sustain erections decreases dramatically. This problem becomes especially common in men with long-standing diabetes, where chronically elevated blood glucose levels damage the collagen and elastin fibers that give the tunica albuginea its strength and flexibility. Over time, this structural deterioration makes erection maintenance increasingly difficult. Cause number 3, psychological interference, the mind-body connection. Even when all physical systems function perfectly, your mental and emotional state can powerfully impact your ability to maintain erections. Stress, anxiety, and performance pressure create psychological factors that trigger the release of adrenaline and cortisol, hormones that prepare your body for fight or flight responses. While this stress response proves useful in genuinely dangerous situations, it represents the exact opposite of what your body needs for optimal sexual function. Adrenaline acts as a potent vasoconstrictor, meaning it tightens blood vessels throughout your body and dramatically reduces blood flow, including to penile tissues. This means that even when sexual arousal is high, an initial erection occurs normally. Elevated stress levels can literally shut down the physiological processes necessary for erection maintenance. The sympathetic nervous system activation overrides the parasympathetic nervous system activity required for sustained sexual response. This psychological interference is especially common in younger men or those in new relationships where performance pressure feels overwhelming. It also affects men who have experienced previous sexual difficulties and now worry about repeat occurrences, creating a vicious cycle of anxiety-induced erectile problems. Your brain serves as the master control center for sexual function. When your thoughts become dominated by worry about your body's performance, your partner's satisfaction, or the sexual situation itself, these concerns can block the neural signals needed to maintain erection. Leave a comment below and tell me if you've experienced any of these 3 causes affecting your sexual performance. I read every comment and often provide personalized advice based on your specific situation. Also, share what country you're watching from. I love connecting with men worldwide who are working to improve their intimate health. The result isn't lack of sexual interest or desire, but rather a direct physiological reaction to psychological tension. Unfortunately, when erection loss occurs due to anxiety, it often creates even more anxiety about future sexual encounters, establishing a self-perpetuating cycle of performance problems. Many men begin avoiding sexual situations entirely because they fear experiencing another episode of erection loss, which unfortunately makes the problem worse by increasing anticipatory anxiety and reducing sexual confidence. Solution number 1, optimizing cardiovascular health. The encouraging news is that in most cases, there are clear, effective steps you can take to address each of these underlying causes. Let's start with cardiovascular-related erection problems. If compromised blood flow contributes to your erection difficulties, improving overall circulation becomes the primary therapeutic target. This requires a comprehensive approach addressing all cardiovascular risk factors simultaneously. Essential steps include managing conditions like hypertension and diabetes through medication compliance and lifestyle modifications, completely eliminating cigarette smoking and minimizing exposure to secondhand smoke, achieving and maintaining healthy body weight through proper nutrition and regular exercise, and committing to consistent physical activity that specifically improves cardiovascular fitness. In many cases, medications like sildenafil, Viagra, tadalafil, Cialis, or vardenafil, Levitra, can provide significant help by enhancing blood flow through PDE5 inhibition. However, these medications work most effectively when underlying cardiovascular health issues are simultaneously being addressed through lifestyle improvements. These medications don't cure erectile dysfunction. They temporarily improve the hydraulic mechanics of erection by enhancing nitric oxide effectiveness. For optimal results, they should be combined with comprehensive cardiovascular risk reduction strategies. Solution number 2, addressing tunica albuginea problems. For problems involving tunica albuginea dysfunction, especially in men with diabetes or other metabolic conditions, the therapeutic focus should center on achieving optimal glucose control and preventing further tissue damage. Maintaining stable blood sugar levels through proper medication management, dietary control, and regular exercise can help prevent additional damage to penile tissues and may even allow some structural recovery over time. In more advanced cases of venous leak, specialized medical treatments become available, including intracavernosal injection therapy. Using medications like alprostadil, intraurethral suppositories containing vasodilating medications, and vacuum erection devices that mechanically assist with blood flow and retention. For severe structural problems, surgical interventions such as penile implants may be considered, though these represent last resort options when other treatments have failed. Solution number 3, managing psychological factors. When psychological factors serve as the primary cause of erection loss, therapeutic interventions focused on mental health and stress management can prove incredibly effective. Working with a qualified sex therapist or psychologist who specializes in sexual dysfunction can help reduce performance anxiety and break the destructive cycle of stress-related erectile problems. Cognitive behavioral therapy techniques can help restructure negative thought patterns and reduce anticipatory anxiety. Sometimes simply understanding that you're not alone in experiencing these problems and that effective treatments exist can provide tremendous psychological relief that directly improves sexual function. Additional stress management techniques that support sexual health include regular meditation or mindfulness practices that reduce overall stress levels, adequate sleep that supports hormonal balance and recovery, regular physical exercise that reduces stress hormones and improves mood, and open communication with partners about concerns and expectations. The most effective treatment approach often involves addressing multiple contributing factors simultaneously rather than focusing on just one area. For example, a man with diabetes-related erection problems might benefit from improved glucose control, cardiovascular fitness improvement, stress management techniques, and possibly medication assistance. This comprehensive approach recognizes that sexual function involves complex interactions between physical health, mental state, relationship dynamics, and lifestyle factors. Addressing only one component while ignoring others often leads to suboptimal results. You should consider consulting with a healthcare provider specializing in sexual medicine if erection problems occur consistently over several weeks or months, if the problems cause significant distress or relationship difficulties, If you have underlying health conditions like diabetes or heart disease, or if you experience other concerning symptoms alongside erectile difficulties. Don't let embarrassment prevent you from seeking appropriate medical care. Sexual health is an important component of overall health and quality of life, and healthcare providers are trained to address these concerns with professionalism and confidentiality. Open, honest communication with your partner about sexual concerns can significantly improve outcomes regardless of the underlying cause. Partners who understand what's happening are more likely to be supportive and less likely to interpret erection problems as lack of attraction or interest. Many couples find that addressing sexual difficulties together actually strengthens their relationship and leads to more satisfying, intimate experiences overall. Experiencing erection loss during sex can feel discouraging and even devastating to your confidence. But it's crucial to remember that these problems don't define your masculinity, self-worth, or value as a partner. In most cases, erection difficulties aren't mysterious or unsolvable. They represent your body's way of communicating that something needs attention. Whether the issue involves cardiovascular health, structural problems, psychological factors, or lifestyle issues, your body is providing valuable information about areas that need improvement. The sooner you listen to these signals and take appropriate action, the sooner you can regain control over your sexual health and confidence. Knowledge represents the first step toward improvement, but knowledge without action remains powerless. Understanding what's happening is essential, but implementing appropriate solutions is what creates real change. You don't have to navigate these challenges alone, and you don't have to accept uncertainty, frustration, or diminished sexual satisfaction as inevitable. Talk to qualified healthcare providers, explore all available treatment options, and don't hesitate to ask for help when you need it. Whether your needs involve physical treatments, psychological support, or both, effective help is available for men who are ready to take action. Remember that sexual health is an integral component of overall health and quality of life. Taking care of your sexual function isn't vanity or selfishness. It's an important aspect of maintaining your physical health, mental well-being, and relationship satisfaction. I'm Dr. James Whitaker, and my mission is helping men understand their bodies, overcome sexual health challenges, and reclaim confidence in their intimate lives. If this comprehensive guide helped you better understand the causes of erection loss during sex, please give it a like, subscribe to my channel, and hit the notification bell so you don't miss future content that could transform your sexual health. What questions do you have about maintaining erections or improving sexual performance? Share your thoughts in the comments below. Your questions might help other men who are facing similar challenges.